Herbs and spices in the Indian kitchen that may help lower blood pressure. Hello and welcome. I am Dr. Yuga, an Ayurveda physician, and today we are exploring the treasure trove of Indian herbs and spices that may help keep your blood pressure in check. The Indian kitchen is a powerhouse of flavors and potential health benefits. In Ayurveda, these herbs and spices are recommended not just for their direct effects on high blood pressure, but also for their ability to balance the doshas, improve digestion, reduce stress, and support overall well being, all of which contributes to healthy blood pressure. Let's look at 10 common spices in the Indian kitchen that can not only make your food delicious but also contribute to managing blood pressure levels. First one is garlic. A staple in Indian cooking, garlic has been linked to various heart health benefits, including potential blood pressure reduction. It is recommended to use about 2 to 3 pods of garlic in your food preparation in various forms, like roasting garlic in a suitable fat for your curry or soup base. Garlic is considered to have pungent and piercing properties which help clear blocked channels in the body. Due to this, it is helpful in hypertension, except for hypertension associated with excessive heat in the body. For these cases, garlic is recommended in moderation. A 2020 meta analysis in Experimental and Therapeutic Medicine reviewed 12 trials with over 550 participants found that using garlic significantly reduced both systolic and diastolic blood pressure, particularly in people with hypertension. Coriander. In Ayurveda, coriander is considered cooling and tridoshic in nature, as in it helps balance all three doshas. It has a natural diuretic effect, helping balance fluids in the body, and has a calming effect on the digestive system and the mind. Both seeds and fresh leaves can be used in your cooking. You can soak dry coriander seeds in hot water the previous night, strain and drink this infusion the next day. This is especially beneficial for hypertension with anxiety. While using it in your food preparations, you can also dry roast coriander seeds before grinding to enhance flavor and release oils. Make sure to add ground coriander early in your cooking, but if you are using fresh leaves, then those can be used as a garnish on any meal towards the end. Black pepper. Black pepper is known to help balance the kapha as well as the vata doshas. Its active component is piperine, which helps lower blood pressure levels and also improves heart health. To use, always use fresh ground black pepper for maximum potency. Combine with turmeric to enhance its absorption and add it at the end of the cooking to preserve its volatile components. Cardamom. This aromatic pod is more than just a flavor enhancer. Ayurveda considered it a natural diuretic, helping to reduce fluid retention. It also calms the mind and reduces stress, which is a common factor in high blood pressure. A recent study showed that cardamom not only helps improve blood pressure, it also reduces inflammation. A 2009 study published in the Indian Journal of Biochemistry and Biophysics found that participants who consumed 3 grams of cardamom powder daily for 12 weeks experienced significant reduction in both systolic and diastolic pressure. The active compounds in cardamom are volatile oils. To preserve these, try adding the crushed cardamom pods towards the end of the cooking process to spice up either your rice or your curry. It can also be added to your tea. However, for teas, simmer gently rather than boiling vigorously. Cinnamon. This sweet spice isn't just for desserts. It may help relax blood vessels, potentially leading to lower blood pressure. Ayurveda views cinnamon as primarily balancing for Vata and Kapha doshas. It improves circulation and warms the body. Sprinkle it on your oatmeal or add a stick to your curry. A meta analysis published in 2013 said that short term consumption of cinnamon, about 120 mg per day to 6 grams per day, is associated with notable decrease in both systolic and diastolic blood pressure. Cinnamaldehyde, the main active compound in cinnamon, is fat soluble. Combine cinnamon with a small amount of healthy fat. Allow cinnamon to infuse in warm liquids for a few minutes before consuming if you are having it with your tea. Turmeric, the golden spice of Ayurveda. Turmeric contains curcumin, which helps improve blood vessel function. Add it to lentils, rice, or try a turmeric latte. A 2019 review in Pharmacological Research examined 11 studies and found that curcumin supplementation significantly reduced systolic blood pressure, particularly in people with metabolic syndrome or diabetes. Curcumin, the active compound in turmeric, is poorly absorbed on its own. Hence, it is best to pair turmeric with black pepper, which contains piperin that enhances curcumin absorption. Combine turmeric with a source of fat, as curcumin is fat soluble. Heat the turmeric gently in oil to increase its solubility. Ginger. This zesty root helps relax blood vessels and improve blood flow. Grate it into your tea or use it in stir fries and curries. A 2019 systematic review and meta-analysis published in Clinical Hypertension found that ginger consumption was associated with a significant decrease in systolic blood pressure. In Ayurveda, ginger is considered to improve digestion and metabolism, indirectly supporting healthy blood pressure. It helps enhance circulation and reduce inflammation in the body. Gingerols, the main active compounds in ginger, are relatively stable during cooking. Use both fresh and dried ginger in your cooking. Dry ginger helps to balance the Vata and the Kapha dosha, is congenial for the heart and promotes digestion. It can also help bring the blood pressure to a normal range and has to be used in moderation for people with frequent acidity and burning sensation post meals. For tea, simmer ginger slices gently for about 10 to 15 minutes to extract its beneficial compounds. Grate or finely chop fresh ginger to increase the surface area and release more active compounds. It is also wise to let the ginger steep in warm water before consumption. Fenugreek. Fenugreek has positive effects on blood pressure, helps reduce cholesterol, and indirectly supports heart health. Soak fenugreek seeds overnight and consume them in the morning. Add ground fenugreek to curries or bread dough. The active compounds, including saponins, are water soluble, so using fenugreek in teas or soups can also be beneficial. Indian basil or tulsi. A 2016 review in the Journal of Ayurveda and Integrative Medicine highlighted the antihypertensive properties of basil or tulsi. You can use fresh basil leaves in your cooking by adding them towards the end of the cooking to preserve their volatile oils. You can also make a tea by steeping fresh or dried basil leaves in hot water. Combine it with other herbs in pesto or chutneys and so on. Cumin. A 2015 study in the International Journal of Health Sciences found that cumin powder helps reduce blood pressure in overweight and obese women. You can use cumin by dry roasting some cumin seeds before using to enhance flavor and digestibility. Add ground cumin early in the cooking to allow its flavors to infuse properly. Cumin's active compounds are fat soluble in nature, so using it in an oil base or in ghee in the dishes can increase absorption. The best way to get all the benefits would be to inculcate these spices in your food rather than opting for supplements which contain the active compounds mentioned here. Incorporate these spices in your daily cooking to potentially support your heart health while enjoying the vibrant flavors of the Indian cuisine. Remember, while these spices show promise, they're not a replacement for a healthy lifestyle or prescribed medication. Until next time, this is Dr. Yuga wishing you good health and great food.